Hello, my name is Nina Pham, and I want to share with you a story that was published in CNN in 2020 about a black physician named Dr. Suzanne Moore who passed away due to COVID in December of 2020. Before she passed, she shared that white doctors downplayed her pain and refused proper treatment, leading her to believe that she was neglected because she was black. She even wrote on her Facebook page, quote, "I put forth and I maintain if I was white, I wouldn't have to go through that." What does this say about our healthcare system when a black woman who's also a doctor has to plead for her life to treat her illness that she ultimately succumbed to? In a recent Forbes interview, Dr. Angela Anderson, also a black woman, details a personal health crisis where her serious symptoms were constantly and repeatedly dismissed by medical staff, which ultimately revealed a life-threatening condition. Her experience stands as a powerful real-world example of how racial bias in healthcare can create dangerous and potentially fatal disparities. The issue is the pervasive and deadly impact of implicit bias, which is the unconscious prejudice against a certain ethnicity or race within the healthcare system. It's a systemic, historically rooted problem where unconscious stereotypes and false biological beliefs distort judgment and leads to inadequate care of patients of color and black people. Healthcare should be a fundamental human right grounded in compassion, not prejudice. When entering a doctor's office, the color of your skin and your race should not play a role in the quality of healthcare you receive from these healthcare professionals. This is a public health crisis that is affecting people of color, but more importantly, and mainly black people. Their lives are at stake and there are statistics to prove it. A research study done in 2021 on racial health inequities documented a 24% higher all-cause mortality rate in the black population in the US compared to the white population. Another 2021 survey conducted by Barrel Institute highlighted a profound racial gap in healthcare. As we can see, 2 in 5 black Americans, or 42%, experience discrimination in healthcare compared to only 5% of white people who reported their discrimination. That is a rate that is 8 times higher, which is a crazy rate. Implicit bias in healthcare is often fueled by false biological beliefs and assumptions about race. A 2016 study directly examined the link between racial bias among healthcare providers and their belief in such biological difference between white and black patients. Commonly held false beliefs include the notions that black people's blood coagulates quicker, their skin is thicker, their nerve endings are less sensitive, and their immune systems are stronger than those of white people. When physicians hold these false beliefs about black patients, they are more likely to underassess and dismiss the patient's expressed concerns. Moreover, a research article analyzing black maternal mortality rates found that the national maternal mortality rate for black women is 4 times higher than that of white women. And another biological assumption that leads to this statistic is that black women do not feel pain the same way as white women. In a documentary titled Racism in Medicine, focused in Germany, Dr. Bismarck Ofori explains how he always has to follow up with his black patients because he knows that they are often mistreated and denied treatment. He also shared that he never has to follow up with his white patients because he knows that they won't be denied treatment. This shows that this is not only a problem in the US, but a worldwide problem that needs to be assessed. My proposed solution to the public health crisis is to implement mandatory standardized implicit bias recognition and mitigation training for all healthcare professionals, including doctors, nurses, residents, med students, and anyone else working in the healthcare field. The training would include historical context to understand the history behind medical racism, the science of bias to understand how implicit bias forms in the brain and influences our judgment, case-based learning that have interactive sessions using real-world scenarios to practice recognizing bias, and finally, de-biasing tools that will help improve patient care. It's reasonable because mitigation training, even in other fields such as policing, have shown promising results in changes in behavior. In a case study done at Massachusetts General Hospital, they found that 85% of their physicians who completed their training felt that they had a better understanding of racial disparities and thought that they learned skills that they would be able to use to improve their patient care. Now imagine a future that becomes possible if we implement this training. Black expecting mothers can walk into their prenatal appointments and instead of feeling anxious or scared, they can feel heard by their doctors. And now their doctors who have completed training can recognize their own bias and listen to their patients intently and attend to their concerns, possibly about aching back pain or swelling feet. These Black mothers can then get the preventative care that they need and leave the hospital healthy with their newborns. This is the future that we can build together, where mortality rates decrease significantly and trust between patients and doctors can be rebuilt. As the next generation of leaders, the most powerful starting point is with ourselves. Our role is to acknowledge our own bias and educate ourselves in our communities. You can start by taking the implicit association test to confront your own unconscious associations that you hold about race. This does not label you as a racist, but it can allow you to understand and accept the truth that we are all influenced by a biased society, and our brains have absorbed those biases. After that, you can carefully make judgments and decisions after carefully thinking through and considering whether your thoughts are based on truth or on stereotypes and biases. While we can't directly help Black patients and treat them ourselves, we can help treat the systems that fail them. This foundational work of self-awareness and accountability is how we as the next generation can begin to heal systems that we are going to then lead. Thank you.